Deputy O'Sullivan, for those questions. I think the first one basically was, are women entitled to a better level of care? And I think when we consider both online telemedicine and travelling, we would say that those services are, although they are clearly providing abortion to people and stopping them from having to use coat hangers and bleach and awful, very dangerous methods like that, they don't provide for all of the needs that women have. They can't. Even though online telemedicine is highly safe and effective, as you've seen in the charts we've shown today, and although people end up with usually pretty satisfied feelings afterwards, they still have to do it illegally. And that cloud of anxiety that hangs over the women that we've talked to and researched when they have to do that, it really wouldn't be called quality medical care when you have to do it sort of cloak and dagger with the threat of prosecution over your head. So I think that they are entitled to better than that. Women who travel, they do access the services within a clinic, but they still have to get home afterwards, and they have to manage sometimes the symptoms and the sort of side effects of the procedure they've gone through as they're traveling home in public, rather than a woman who is living close by to a service and can go home and manage those quickly at home. So I think that there's definitely a disparate level of care between the two. What's lacking? I do think that the services, as my colleague here pointed out, best practices in abortion services, that they should be not just available but accessible to everybody, regardless of cost and ability to pay, regardless of reason and who you are. And I think at the moment, there is a system whereby women who have the resources, they have the money, they can travel. They may not have a great experience, as we've heard from a lot of women who've had to travel back home again, managing symptoms and leaving children at home and so forth. But it's very, very hard to integrate continuity of care when you can't just go to a healthcare professional and have everything, your decision and the procedure itself and your follow-up care, all with a continuum within the same healthcare service. When it's all broken up like that, the way the women here have to do, it's very, very difficult to have a cohesive service that meets everybody's needs.